Abuse is 100% preventable, whether it be physical abuse, sexual abuse, or child neglect. Absolutely preventable. There's no medical basis for it. Its causes are rooted in social dynamics and social interactions, and because of that, there's no medical basis. We can prevent this 100% of the time.
We are trying to, on a regular basis, really take this issue and not just address the needs, because those are all there and always going to be there, but also make other people aware of it.
Sexual abuse is so common, and it's something that doesn't get talked about. And yet it impacts us as a culture for generation upon generation upon generation.
What's unique about ChicagoCAC is that we're the only not-for-profit in the city that brings together all of these wonderful entities that are responsible for child abuse investigation, and our job is to help them all communicate with each other.
This team responds to these hotline reports. It brings together the law enforcement agency, DCFS, and specialists at the 3 hospitals involved, which are Lurie, Stroger, and Comer. And then we work the case from beginning to end.
If I do have a question about the forensic interview, if I have a question about the family advocates' interactions with the family, I can go to those people and get some really good, helpful information about the case from them.
Before child advocacy centers existed, oftentimes children had to go to multiple locations to streamline the investigation and hopefully have the child tell the full extent of the story one time is the best thing for the child.
The bottom line is we restore children's lives.
I do believe at CAC we save these children's lives. Without the specialized DCFS and police investigators, absolutely these children would present as sick children more often than not and be overlooked and treated as such and go home and ultimately have more drastic impact from their injuries.
When they come in here, a lot of times they come in feeling hopeless, feeling definitely this dark secret. We give families so much hope. It's just amazing to see the changes on their face when they come in. Most of the families that I meet with tell me, we're so glad we met you.
It's such a special opportunity to watch someone grow and heal and begin to feel like themselves.
At the end of the day, that's really what it's about. So no matter what happens with the investigation, no matter what happens with all the details of the day-to-day work that goes on here at the center, that child's going to leave here with a sense of hope, with a sense that they're going to be okay. And I really do believe that the work that we do changes their lives for the better and restores their lives so they can be happy, healthy children once again.
I think letting them know that there's going to be this whole extra floor just for you, just for people who have gone through this and who need some extra support, makes them feel really good. A lot of people haven't had anyone demonstrate that to them before. And I think for us as a team, it's really exciting too, just to know that we'll have kind of a home, that we'll be there for a while.
Teaching adults how to be responsible for children, keeping them safe, learning how to talk to kids about preventing abuse means that more kids will grow up in a world where they don't experience violence.
We're just really looking forward to having a much nicer space and being able to hire more mental health therapists or possibly another case manager and just serve more kids who are currently waiting on the centralized wait list.
It's time to focus energies on primary prevention. And the growth of our building and our space will allow us to do that. We have a lot of initiatives around the space that is conducive to do more prevention and training so that we can teach parents how to keep their children safe. We can teach teachers and other caregivers how to create environments that will reduce the risk of sexual abuse ever happening.
I know that I'm providing as safe and as comfortable as an environment as I possibly can, and I know that I also believe kids. And so it's comforting to know that at the end of the day, however many children I've talked to, that we were able to talk to each other.
There are so many families that come into our center who don't have the resources. We provide them with that. They don't have the education about trauma. We provide them with that. We provide them with so many things that, you know, our families are in need of.
I know it's been a good day when the families and the children that we bring to the center leave with a smile on their face.
Sometimes all they need is just like a little push or just, you know, some words of encouragement for them. I'm just so glad and so fortunate to be able to be part of that journey for them.
You can see how much having a team of staff that really cares and really wants to help in their healing matters.
Your support of our prevention and outreach efforts means that we can all work together to create a safer world for children.
Seeing these kids with smiles on their faces because they really do feel like the worst part is over. You know, the trauma of what happened to them is over now, and from this point forward, they feel safe because of the services that we provide for them.
You're doing a really, really good job.
Thank